Welcome, everybody. Good to see that you guys were able to make it. It means your power wasn't knocked out today. We've had an amazingly fun day here at Full Circle with the lights going on and off and our EMR going on and off. But we're all here together now. Yay. So, welcome to the Practice and Pregnancy Orientation. I am your host, Dr. Adams. Many of you have already met me. We did your virtual visit for your history. Some of you have your histories coming up, but we are going to walk through this together. This is live. So if you brought your questions with you, I will answer them today. Let's get started. We have a couple of housekeeping items first. First of all, this is confidential. So whatever you ask me, no one can tell that it's you asking me the question. So ask whatever you want. Um, Please participate. Please participate. I have some poll questions hidden throughout here to make sure that we're driving certain points home and that we're paying attention and listening. And if you have to jump off at any time, I understand it's dinner time, and this presentation will be available on our YouTube channel for the duration of your pregnancy. So this is what a poll question is going to look like. So you're going to answer who's on the line for me first. How many first-time moms do I have on the line? How many veteran moms do I have on the line? Then I'm going to stretch for a little bit as if I'm a newscaster, and you all are going to type in what your answers are. And I'm going to say something like, the polls are closing in 3, 2, 1, boom. And usually the polls will close right then. So I think only half the people on the line this time actually answered. So that was a good practice. Next time you'll do better. I really don't know, but by the poll, I have more mommy veterans than I have first-time moms on here, and perhaps some people are listening. Hopefully not in your cars. I hope you're not driving in this weather. What we're going to be going over today will include the full circle experience, which includes where we deliver. We're going to go through some office protocols, including how to best contact us. We'll tell you what to expect at your pregnancy visits. Going to give you lots of prenatal resources. We will talk about exercise and nutrition in depth, and we'll wrap up with a COVID-19 update because that's still a thing. All right, so first let's talk about the full circle philosophy. So the collaborative midwifery model of a practice starts from the premise that pregnancy and birth are normal life processes, not a disease of which we must cure you. To that end, it copies the traditional model in that we care for normal, low-risk women. But in the traditional model, if an abnormality is identified, like gestational diabetes, high blood pressure, or breech, you have to transfer out of the care of midwives in order to reach the other acuity of care. In the collaborative model, though, you can stay in the care of the physical care of the midwife with physician direction for whatever the complication is. For example, Dr. Merrill handles our gestational diabetics. Dr. Mooney will handle our gestational hypertensives. Um, to that end, I know some of you came in as our GYN patients and you say, oh, great, now we're just going to carry on and you'll still be my doc for delivery. Possibly. Most of our normal labors and deliveries are attended by our certified nurse midwives. And now, if there's something outside the scope of what they're able to do, then they can call for a physician consult. One of us is always backing up our own midwives, so you'll have a full circle delivery no matter what. If it is something urgent, like can wait about 15 minutes, but not until tomorrow, one of us will come in from home or wherever we are. We're all usually between 15 and 20 minutes away. If it is something emergent, like it cannot wait 15 or 20 minutes, there are board certified OBGYNs in-house 24 hours a day to get anything started to keep you and your baby safe. To put that in perspective, we did almost 550 deliveries last year, and only 3 times did we need the hospitalists at all. And I will even say that the most common reason we need them is not something bad is happening, but something fast is happening. So if you come in 10 centimeters and they haven't had time to call us and tell us that you're there yet, there is a doctor there. It's not our preference that someone else catches our babies, but sometimes your baby doesn't know how wonderful we are and they can't wait for us. All right. Where do we deliver? We're at HCA Florida Hospital now, which is less than 10 minutes from the office. They are doing tours, one-to-one tours. We also have the stork tours. We just did one in August, which was really sweet. It's like a baby shower. And they have gifts, raffling prizes, and food, all that good stuff. But if you're not able to make one of those, the dates for those are posted in your exam room when you go in for your visits. You'll see it up on the wall. and the phone number to call to register. If those dates don't work for you, don't sweat it. They do one-to-one tours. You can still call that same number and let them know what day. They do them in evenings, they do them on the weekends, during the day, whatever time is most convenient for you and your family to come and see where you're going to meet your little one or your little ones. All right, office hours. So our office is open Monday through Thursday from 9 a.m. to 1 p.m. We then close for lunch from 1 to 2, and then we reopen from 2 to 5. The reason we close from 1 to 2 is if you have a medical emergency during that time, then the phones roll over to our emergency on-call service. So if you have a medical emergency between 1 and 2, you can leave a voicemail. If it is a medical question, like I'm not sure, or if it's something administrative, I think I need to reschedule an appointment, I'm looking for some forms, please do not leave a message on the emergency number for that because the on-call midwife who is taking care of patients in the hospital is not going to call and relay the messages to the afternoon crew. Just give us a call back after 2 p.m. and one of the front desk ladies will be happy to help you. On Fridays, we're open from 9 a.m. to 1 p.m. So if you are calling with an administrative issue on Friday at 12:53 p.m., you may get a response on Monday, or like in the case of this week, our next business day is sometimes Tuesday. We also, you'll see the next slide, do not have walk-in appointments. We have limited same-day appointments. So sometimes someone delivers or cancels and an appointment slot does come open, but our goal is to see you as close to your appointment time as possible. And so if we promised you the 12:20 slot and someone walks in at 12:15 and says, I need to be seen, that's not fair to you to give them your 12:20 slot. You've taken off work, you've traveled across town, you've gotten childcare, and that is your time. And so we ask that you respect other people who schedule their time as well. If it's something urgent, say you're calling us at 9 in the morning with a problem. If there's an opening in the day, we'll try to put you into that slot for that day. If there is not an opening and we say, but hey, actually, you're right, you should not be, you do need to be seen, we may recommend that you either go to labor and delivery for evaluation or that you're seen on urgent care. It's not us saying that we don't want to take care of you. It's us saying we don't think that an appropriate place for your problem is sitting in our lobby waiting for someone to no show so that we can work you in. And also try to remain respectful of your time and the time of everyone else who is scheduled. When you call the office, providers are not able to leave appointments to take phone calls because, again, we promised that time to someone else. I wouldn't leave your appointment to talk to another patient because you are the most important person at that time. And so the providers are not able to. Tony is our nurse, and if you have a clinical question, she hears the same questions she has for many years, and she can answer most of them because she's seen this a lot before. If you are calling and she's already on the line with someone, you might have to leave a message with her and she will give you a call back. But you do have to leave a message in order to get a call back because we are not able to just call people back based on caller ID saying, oh, this person is calling. If you're leaving messages, please be sure that you're leaving them with the right person. There may be a lag on your end, but Tony, as I mentioned, is our nurse who does letters. She does phone forms like FMLA and short-term disability, which I'll give you more information on in just a moment. And as I mentioned, nurse calls. The OB clinical coordinator is Naisha, and she does referrals. She does labs. Many of you have already heard from her because she sent you your prenatal labs after your history visit. If at the end of pregnancy you need something scheduled, she's also the one to schedule versions, deliveries, C-sections, all that stuff. If it's something administrative, everyone on here who has any insurance obligations, Renee Hall is our benefits coordinator. So if your insurance changes in January, as a lot of them do, please let Renee know so we can update what your payment plan is here because you might not need it anymore with your new fancy insurance. And we don't want to keep collecting on something that we don't need to, especially around the holidays. All right. After hours, there is always someone on call from our practice for our practice. One of the midwives is usually taking first call. This is the person to call if you think you need to go to the hospital. This isn't following up on lab results or anything like that, unless the lab results determine you going to the hospital. Also, again, you have to leave a voicemail for us to call you back. So the phone doesn't even register that a call came through unless you leave a voicemail. So just follow the prompts. You call the regular phone number for during the day and follow the prompts for the after hours line, and you'll get to one of us who is holding the call phone. The patient portal is another way to contact us, but do remember that response times can take up to 2 business days. That is especially difficult on holiday weekends. So people who sent a message on Thursday might not get a response until Tuesday. But 2 business days. So typically, if you send on a Monday, you'll get an answer on a Wednesday. Or if you send it on a Friday, you may get an answer by a Tuesday. If it's a non-action item, we'll answer it at your next appointment. So if you're just wondering, is this vitamin okay? Something that can wait until we see you, especially if we're going to see you in the next couple of days, we might pass it to the person who's seeing you next, or you can bring it up at your next appointment. So the portal is best used for things like I lost my lab slip. So that's an action item that we can take before your next visit if you're trying to get those labs done before your next visit. Or I have COVID, so I need to cancel my appointment or convert it to a virtual appointment, so I'm not coming into the office. That's something also that we can take care of via the portal as long as there's 2 business days between the time you send. So the portal, remember, is something that we do after we've seen patients all day, done all our charting, reviewed all our labs, reviewed all our ultrasounds, and dotted our I's and crossed our T's. So having whole visits in the portal or multiple messages gives a higher likelihood that something urgent will get lost. So please do not send urgent matters like high blood pressure, my baby isn't moving, I'm having heavy bleeding. That is not what the portal is for. It is for things that can actually wait a couple of days. We also don't want you to blitz message providers. So if you've sent a message and you haven't, it hasn't been 2 business days, please don't send the same message to someone else. Multiple messages to one provider. If you started a topic of conversation, please just keep replying to that message instead of starting whole new messages. Because if somebody is out and there are multiple places that you and someone have already been talking about something, it's not an efficient use of our time to try to dig through the chart and figure out where you guys are in this offsides conversation. And we also ask, please don't try to have appointments via the portal. So sending labs and articles and asking us to review them and comment on them, that's an appointment. And again, we just did appointments all day long. We want to spend time with our families, please. So we ask that you text yourself questions or schedule an appointment because we are here seeing you at appointments. And we're happy to have those conversations then in person. Ultrasounds are also released via the patient portal. So if there is something urgently abnormal about your ultrasound, we will not let you out of the building without discussing it with you and making a plan that day. Our sonographers have been at this for many years and they know what things are urgent and need to talk to us. So that's the one time that we will break our schedule and come and talk to you. Otherwise, we download the reports from the machines, upload them to our electronic medical record system, divide them among all of us, and review them. So please give us 2 business days. It's just as if you went out to another facility and we're waiting for the report to get sent to us. Sometimes you'll see Kathleen or Taylor typing away on their computer and you're thinking, oh my gosh, what is she writing? And you come and send a portal message, what's on my ultrasound? We won't know yet, but what we do know is that it is something that is not urgently abnormal. So please give us a chance to receive the report, review it, and release it to the portal with our commentary. You can always reply there if whoever went over it with you doesn't answer all the questions that you have about it at that time. Quest also has a portal. I think some other commercial labs do as well. And they have this nasty habit of sending the results to you and not us. And then you get the results and then you see red on the paper and you start Googling and next thing you know, your last will and testament is all written up. Just because you see red on the paper, it doesn't necessarily mean that your lab is abnormal. The reference ranges that they use on those papers are for non-pregnant people. So pregnancy reference ranges are different. So there may be something that you see on there that would not be okay if you weren't pregnant, but because you're pregnant, physiologic changes say that it's all right. So give us a chance to receive the labs from Quest, review them, and release them. Please don't send us the labs screenshot from your portal because that doesn't close our loops. And admin is all about closing loops. Just if you've been sitting on the labs for over a week and you have not heard from us, then let us know so we can request them directly from Quest and let them know that there's a problem with them sending stuff to us. I'll put a little pin in this as I ask for any questions on that. Please use whatever name you're using at our office. Use that every place else you go. That is the most common reason we don't have people's labs. Some people are engaged or planning to change their name, or you changed your name in your heart, but not with your insurance company. And so when we receive things, we have an electronic system that sorts them by your demographics. So if the last name doesn't match, we'll have something sitting in limbo, EMR limbo, just not getting sorted into your chart. And that delays us being able to give care. So please choose one name, my secret agents, and use that throughout the entire pregnancy. All right, cool. No questions. We are moving on to what to expect at your visits. So expect that you will be overtaken by pregnancy brain. Placenta brain is serious. Text yourself questions. Start a thread with yourself with all the questions that you're going to bring to your visit. Because as soon as you hear that baby's heartbeat, you're going to forget all your questions. We ask you to wear loose, comfortable clothing so that we can access your belly, because we're going to be listening to baby's heartbeat at each visit. Not necessarily doing an ultrasound, but using the Doppler to listen to the heartbeat. We want you to get here about 5 minutes before your scheduled appointment so you'll have time to check in and handle whatever business needs to be handled at the front desk, and then leave a urine sample if it's indicated. So, American College of Obstetrics no longer requires us to check a urine sample with every visit. So, we know you're pregnant, you've been driving across town, and you're drinking your water. I hope you're drinking your water, and you need to go to the bathroom. So please go ahead and do it, unless we're following you to check your urine for protein because of high blood pressure, for blood sugars, or if you had a recent urinary tract infection and we're checking a test to cure. Front desk will typically know if we need a urine from you. So we know if you got to go, you got to go. So go. We also just want to remind you, if you are 10 minutes late, we will still have time to check on you and your baby. We'll check your blood pressure, the heart rate, go over any labs, but that does leave us less time for the questions. If you're 20 minutes late, that is the entire appointment slot. And again, trying to be respectful to the person who has a slot scheduled directly behind you. If we can, we'll try to work you in later in the day, or or if that time doesn't work for you, we can reschedule to a mutually available time that works for everybody. Diagnostic ultrasound visits. So the question we get is, when am I going to have another ultrasound? That was so much fun. Great question. So diagnostic ultrasounds are separate from prenatal visits. So the way to find out if you're scheduled for an ultrasound, if you're having an ultrasound next, because they won't be with every visit, do you have more than one appointment time? And is there a provider's name associated with your visit? So when Tina Test, my imaginary patient, logs into her portal, she clicks on appointments, and Tina sees that she has 2 appointments scheduled. One is scheduled with ultrasound, which is not a provider's name, and the other is scheduled with Dr. Yeckel, which is a provider's name. So Tina can tell her family, hey, I actually have an ultrasound coming up this time. Why don't you guys come with me? Take a look at the baby. And then afterwards, you can stay, hang around, and meet with Dr. Yeckel. Now, if remember, we talked about ultrasound results coming out about 2 business days afterward. If you know that your anxiety will not allow you to wait 2 business days, please try to schedule your ultrasound visit on the same day as a visit with a provider. In those cases, the provider can get a preliminary printout from the sonographer and can go over it with you during the visit. So Dr. Yeckel could get a prelim report and hand that over. Otherwise, the results are sent to the portal within 2 business days, unless there's something urgently abnormal. Just remember this: we won't let you leave the building. When you're checking out from your prenatal visits and your provider says, hey, it's time to schedule an ultrasound, when you go up to the front, be sure that you are scheduling a prenatal visit as well as an ultrasound. So remember, you should have 2 separate visits, which you will be able to track on your portal as both of them being scheduled. If you know your schedule, you should be having an ultrasound, but you don't see it on your portal, please check in with us to be sure that you do have an ultrasound scheduled. All right. If you want to look at your baby, but we do not have a medical reason to do so, this is why boutique ultrasounds exist. So there are a couple places on here for informational purposes. We're not endorsing any one over the other, just try to get a couple in different areas of town. But these places do boutique ultrasounds, which are just cute, fun ultrasounds. For those who don't do genetic testing and want to know what the baby's sex is, they do gender reveal packages as early as 14 or 15 weeks. And then for those who just want to look at their baby later, they do 3D ultrasounds, or they'll put the baby's heartbeat in a little stuffed bear. It's really cute. All right, so our next poll question is about You guessed it, ultrasounds. So when can you expect to have routine ultrasounds? And the polls are open. All right, so are you having an ultrasound at every visit? Are you having them at 20, 40, and 41 weeks? Or would you only get an ultrasound if you have a problem? And the polls are closing in 3, 2, 1, closed. All right, at 20, 40, and 41 weeks. So the key word here is routine. Your anatomy ultrasound's around 20 weeks. If everything looks good and we see all we need to then, the next time, if you develop no complications throughout pregnancy, we don't need to look until you go past your due date. All right, we're headed over to the website. I believe now we're going to go to fullcirclejacks.com. Yes. All right, and we'll start out with the providers. So let's talk about who is going to be lucky enough to attend your delivery. So one of these lovely ladies doing their very favorite thing to do. There's me, there's my partner, Dr. Marrow, there's Dr. Yeckel, there's Dr. Mooney, there are the midwives, there's midwife Lauren, midwife Krista, midwife Cindy, midwife Dawn, midwife Missy, and midwife Jane. And again, everybody on here is doing their absolute favorite thing. You can click on our bios and learn a little bit more about us and how we came to go on this journey with you. Again, at the top, though, you'll see patient information, and you're going to click on the obstetrics tab. And you'll know you're in the right place because you will see all the growing bellies and the baby at the end. We're very transparent with our numbers, so you'll see things here on our delivery statistics dating back to 2018, I believe. And some years are better than others. Some years are amazing. So we hope you are part of our amazing years. The next box we're going to click on, though, is the prenatal care timeline. So now we're going to talk about what to expect at each visit. So everyone who is on this call has already had your pregnancy confirmation visit. And at that visit, you had an ultrasound, you met with one of the midwives, we set a due date, and then you sat and spoke with Renee Hall, and you watched a little video with me with better makeup and hair telling you about this webinar. And then they told you your next visit was going to be virtual. So some of you have already had your virtual visit with me where we go over your medical history and your pregnancy history and make a general plan for our direction. Some of you have your history visit coming up. Remember, that is virtual, saving you some gas money. I've had a couple people come in for the visit recently. That is virtual, so because it's just a conversation. After that visit, we'll know, based on your history, what labs need to be ordered in addition to the standard prenatal labs. So again, lab transparency here. These are the standard prenatal labs that the American College of Obstetrics and of Obstetricians, rather, recommend for prenatal labs. The second part of those labs is a couple boxes down. We'll talk about those in a moment. After you talk to me, your homework is to try to get those labs done as soon as possible. Some of you are just going to Quest or LabCorp, and you may be held up by when they have appointments. Those who opt in for genetic testing are going to First Coast Testing Services, and they're typically pretty open in terms of their appointments. So if you, if at this point you have opted out of genetic screening, then your next thing is the box beneath that, 12 to 14 weeks. At this point in pregnancy, we're seeing you every 4 weeks. So about 4 weeks after your confirmation visit in office, you should be back in office to have your OB physical exam. If you're due for a Pap test, you are welcome to have that done at that time, but that's not part of the ACOG panel, so it's not required, so to speak. The cervical cultures, though, are part of the ACOG panel, and we do collect those at that time. Those who are expecting to see the high-risk doctors for previous diagnoses, you will probably have already had your referral sent if we discussed it at your history visit, and this is usually around the time that they start seeing you, 12 to 14 weeks. So 4 weeks later, though, you're back in our office, and if you opted in for genetic testing, you may decide to do the tests for baby spine and neural tube defects. And then about 4 weeks later, you'll see is about the time for your anatomy ultrasound. Yay. You'll see there in the middle 2 mental health screens. So pregnancy, we know, is full of ups and downs emotionally. And we want to be sure we're taking care of the whole person. So if you have a history of depression or anxiety, you'll definitely be screened, but just know that we screen everyone. So if you are being screened for depression or anxiety, it's not calling you out, it's making sure that we are taking care of you holistically. If you're meeting with a midwife on the same day as your ultrasound, she'll start talking about childbirth education classes and breastfeeding classes. If your visits are kind of staggered, then she'll talk about it around that time. About 4 weeks later is when we look at glucose testing, and I know you have questions about that, so we're going to put a pin in glucose testing and come back to it, I promise. My moms who have a blood type that is Rh negative, which is something we would have found out from your prenatal labs, we will secure medication if needed to give you around 28 to 30 weeks. At this point, we'll have you complete your hospital pre-registration. It's all done online, so we'll give you the information to do that. If you're planning on working with a doula, we'll talk about doulas in a little bit too. And make sure that you have scheduled or are planning to schedule one of the hospital tours. After the 28-week mark is when we start seeing you every 2 weeks. So you'll see there in the middle, there's an option to repeat or decline your standard prenatal labs. That is from Duval County Health Department, not necessarily from ACOG. So if you decide to decline it, there is an opt-out form for it. Over here on the right side, though, you'll see the Tdap, the influenza, and depending on the time of year, the RSV in vaccinations as well. We don't do those here in the office. If you desire to have them done, we can either write a prescription to Minute Clinic or you can go back to your primary care for it. So we start seeing you every 2 weeks. My moms who have certain pregnancy complications will start more antenatal testing, listening to baby's heartbeat and ultrasounds around this time. For my moms who are planning a belly birth, which is our term for the C-section, if you're planning a belly birth for whatever reason, the predisposing reason, we try to start scheduling those around 33 weeks so you can get your date and start planning for family and all that stuff. 36 weeks is when we start seeing you weekly. So if you have a birth plan, which we'll talk about in a moment as well, going to bring it in for discussion, start your natural cervical ripening methods, and we do one more test, a screen for group beta strep. And we'll talk about what that is at that visit and why it's important. If you've already opted out of repeat STD testing in third trimester, then that also extends to repeat cervical cultures. All right, now you're full term. Look how fast that went. So my moms who are getting off the bus for a belly birth, those are all done by 39 weeks, usually at 39 weeks. But if there's some other reason that it needs to be sooner, that's something we discuss in your history. And then we wait for everyone else. Just wait for this baby. We want everyone evicted by 42 weeks. So first time mamas, 41 weeks and 5 days is when we would want to schedule an induction, 41 weeks and 6 days for my veteran mommies. Remember, this is out here on our website, so feel free to go back out. You can print this out. You can always come in and ask questions about what's going on. I think we're headed back to the website now to the next box that we can click on. But remember, you can bring this in and ask questions about what's next. All right, poll question. If you have a headache during pregnancy, are you more likely to meditate or take a Tylenol or go to the emergency room? And the polls are closing in 5, 4, 3, 2, 1. Boom. All right. Okay, we have more meditators than medicators here today. Cool. For me, I'm probably going to be more of a medicator. Got to go on. So some of you have already talked to and you had some pregnancy stuff and you're like, oh, I can't take anything because I'm pregnant. False. Here is our list of safe medications and interventions in pregnancy. So not everything on here is medicine. In the middle, you'll see the relief measures. Alphabetically listed are the discomforts and symptoms on the left side. The relief measures are the things that we would recommend you try before we go to any medicines. And over here on the medication area, you'll see not everything is Western medicine, so to speak. There are some things that are more holistic. You'll see peppermint oil and vitamin B complex and rosemary and all that stuff, aloe tablets. But then, if those things don't work, there's also which over-the-counter medications. Like you guys are going to be pregnant during cold and flu season too, so a lot of sore throats, scratchy this and stuffed up that's. So these medications are on here as well as some caveats, avoiding certain medications that are not safe or avoiding certain medications at certain times of the pregnancy. For nausea, vomiting, if you cannot keep down fluids for 24 hours, please do not keep trying things on this list. Please let us know because you need to come in for some IV fluids. And we want to be sure that you are not getting dehydrated, which is harmful for you and for baby. So just remember all of these things are out here. And y'all gotten smart. You used to send me messages, Dr. Adams, I'm constipated, and I would send you this link. But now I get the message, Dr. Adams, I'm constipated, and I've tried everything on the website. What else? And so, all right. So the first thing that you're going to get from everybody here is, have you tried everything on the website? So save yourself that back and forth portal message. Try the website. The next box is gestational diabetes screening. I said I was going to discuss this, but now is not the time. We're going to come back to it, but do remember that this box is here. Next is weight gain in pregnancy, because some of you are concerned that you have not gained any weight in your first trimester. Some of you are concerned that you gained too much weight in your first trimester. Here is the recommended pregnancy weight gain based on your starting pregnancy body mass index. There's a link there at the bottom you can click on and type in your height and weight at the beginning of pregnancy. And that based on your pre-pregnancy category, it will tell you what your recommended weight gain is in pregnancy. What you'll see in that last column is that the rates of weight gain are in the second and third trimester per week. So first trimester, I know everybody's sick. Nobody wants to eat anything. Nothing tastes good or smells good. So it's okay. Food aversions are normal in response to the pregnancy hormone, and it's not counted in your total overall weight gain at the very end of pregnancy. So don't sweat it if you haven't gained enough in the first trimester. All right, going back. Birth preferences. So some of you are probably planning to make a birth plan. Here is our template for the birth plan. So this has a lot of good information on it. So first-time moms especially, you may have a lot of anxiety because you've never done this before. Second-time moms, you may have anxiety because you didn't like the way it went last time. Writing things down, making clear plans is very helpful to take some of that anxiety away, and it's good for clear communication as well. So you'll see on here a list of a lot of things that you can do. You don't like hospital gowns, don't wear the hospital gown. For my moms who are trying for a VBAC, there are restrictions with regard to monitoring. It must be continuous, but you don't have to be on the wired monitor. We have wireless monitoring. There's intermittent policies for my moms who have not had any uterine surgeries before. Other things to highlight: we don't strap you down and starve you. There's options for hydration and for movement. You can move around during labor. Obviously, everything doesn't apply to everyone. So if you have sky high blood pressures and that's very scary, we're not going to have you in there doing jumping jacks and squats and everything like that. We want you to lie still and keep your blood pressure down. But for most laboring women, most things on here are good options for you. So it might seem like a lot. There are 21 boxes here. Not every box is going to apply to you, but everything from, how you want to control pain, what position you want to deliver in, delayed cord clamping, newborn medications. You can bring these things in and ask the midwives, hey, what does this mean? Does this apply to me? Does this even matter for me? And they're happy to talk you through it as well. So also something really good to go through with your doula. We'll talk about in just a moment. So again, our spot on where to start talking about this was after 36 weeks. So once you're a full term, almost anything on there is fair game. So cervical ripening techniques, a lot of those kick in at the 36-week mark as well. So we're going to open this up and take a look. Starting at 20 weeks, you can start raspberry leaf tea, but most of these things do occur after 36 weeks. So these are not designed to put you into labor. They are to soften the cervix and tone the uterus. And so you can just kind of go week by week and see what we recommend there. And the one thing that you will not see on there is castor oil. And I actually saw a patient just the other day and we had a good laugh about why not castor oil. But remember that these things are out here because at the end, you're always like, how do I get this baby out? You don't. The baby gets him or her or their self out, and they will tell us when. But we just want to make sure our body is ready when the baby tells us when. Do I have any moms on the line today who have had a C-section before and are going for a VBAC? If so, please answer yes. If not, I'll just be talking to the first-time moms. Polls are closing in 3, 2, 1, done. All right. So most of you are not, but I do have a couple who are going to rock it because that's our positivity here. So this is for first-time moms as well, because you don't have a proven pelvis, what we call a proven pelvis. So what you're trying to do is avoid that first C-section, which kind of affects what everything else happens. So the same thing the VBAC moms are trying to do. Control what you can. Babies are going to baby. You can't stop them from doing that. But what you can control, ways to reduce conversion to cesarean. You can just go line by line, seeing your Webster certified chiropractor, doing your exercises, taking your method classes, hiring an experienced doula, making sure baby gets into good position, watching your weight gain during pregnancy. Don't get exhausted at the end and say, I'm just done. I want this baby out. First time mamas, because sometimes y'all do that. And then you come back for your be back and say, I just wish I had waited. So just trust us. If we're saying your cervix doesn't, your baby's not in a great position, let's just wait a little bit. It's because our mission is to try to get you the best, healthiest, and safest birth with as little intervention as possible, as safely possible. So please trust us. We want the same thing you do as well. All right. Going back. Lastly, if you have a little guy and you'd like to have him circumcised, this is the information for how to take care of it afterward. We do those in the office when he's up to 10 days old. We don't do them in the hospital. So the way it works is you remind us at your delivery that you'd like to have a circumcision done, and Naisha, my OB coordinator, reaches out to you with his little appointment and you bring him in. All right, fullcirclejacks.com. So remember, this is where all that information is when you need it. All right, so for those who are very concerned about your weight gain thus far, and you're saying, I don't know what, I'm not doing anything different, Dr. Adams. I just had coffee in the morning. Was it coffee or was it a salted caramel mocha? So you can see the difference between these two things. But did you know that pregnancy only requires an additional 300 calories per day? Not a lot. It's not eating for two for sure, because you require more than 300 calories per day, but your baby does not. It takes 1 kilocalorie to maintain a pound. And so the amount of weight gain, as we discussed before, is based on your starting body mass index. So let's say you're starting a pregnancy at 170 pounds, take 1,700 net calories to maintain that. If your goal pregnancy weight gain is 250, excuse me, please don't gain 250 pounds, is 25 pounds. That's 250 additional calories for a total of 1,950 per day. Dividing that between breakfast, lunch, and dinner, your total calories for the meal should be around 650. If you eat 650, you cannot wash it down with a 570 mocha monstrosity. All right. This slide has lots of just little things to think about. Small changes can make a big difference. Things like, guarding your sodium, which we'll talk about in a moment, but changing from traditional spaghetti sauce to herb-infused marinara can knock 500 milligrams of sodium off of your day. The amounts of fats and proteins and carbohydrates are over here as well. So again, remember this is on our website too. All right, so what things should you be eating? Fruits, veggies, whole grain, cereal. You're not going to give your baby an allergy to nuts or dairy if you eat those things, so please enjoy. For my coffee drinkers, you want to keep your caffeine at less than 200 milligrams daily, which is still a lot of caffeine. So caffeine is a diuretic, and you can dehydrate by drinking too much coffee without replacing with adequate water. So the 3-to-1 rule is what I usually use for that. 3 times as much water as caffeinated beverage. Herbal teas are fine. Our favorites for pregnancy include raspberry leaf, ginger, lemon, and peppermint. And for my vegetarians, pescatarians, 70 grams of protein daily. For my bodybuilders, you don't need more than 70 grams. You will grow an 11-pound baby if you start cramming in. I know some of these pregnancy diets say 120 grams of protein a day. One, I don't know how, but two, it's just, it never works out well. Deli meats you can eat as long as you microwave them for 30 seconds. I know there was a recent recall on some boar's head meat, but microwaving things for 30 seconds has been shown to get rid of the harmful bacteria associated with the deli meats. Same thing for soft cheeses. As long as it's made with pasteurized milk, it's fine. If you cannot verify if it was made with pasteurized milk, like flip it over from Publix or Trader Joe's or Whole Foods, then don't eat it. Like you're out at a restaurant, you can't tell whether the brie is pasteurized, and then don't eat it. Canned tuna, you can have up to 3 of the 4-ounce cans per week. If you need more fish, my pescatarians, the FDA has a really nice document out here about fish that you should avoid completely because of methylmercuries, those that you should eat sparingly, and those that you should eat a lot of because they're high in DHA, which is good for baby's brain development. So even though this document says October 2021, that is the most recent one that they have about fish to eat and fish to avoid. Things that you want to avoid: undercooked meats and fish. So everything has to be ruined for the next 6 months. Well done is what other people call it. Kombucha drinkers and kimchi eaters, those are fermented foods and beverage. You want to have those in very limited quantities. Alcohol, you want to have not at all because we're not certain how much is safe in pregnancy. And you want to limit your sodium to 1,500 milligrams per day. Once you start actually looking at the sodium on the back of your foods, you will be appalled at how much is in there. So, are there any questions on nutrition before we go to exercise? And crickets, not a single question yet today. All right, maybe y'all are the workout crowd. All right, it is fine to continue your pre-pregnancy activity as long as your pre-pregnancy activity was not doing nothing. You have to be doing something. You just won't feel like doing very much in your first trimester, but in second trimester, you'll increase your blood volume by 50%, which does increase your oxygen tensions and saturations, and you'll feel more like doing that aerobic activity again. So just listen to your body and you will regain your Olympian status that you had prior to pregnancy. If you weren't doing anything before, it is okay to start a new regimen, and it does not have to be anything crazy. But please remember, sedentary lifestyles, if you don't do anything, that leads to malpositioned babies. Malpositioned babies are our most common reason for cesarean delivery. Those of you with these Fitbit watches, the resting heart rate may rise 10 to 20 beats per minute. That is physiologic and that is normal. As long as you're not getting dizzy or passing out with elevated heart rates, that is a normal change of pregnancy. All right. For those of you who are walking as your exercise, please remember that walking must be performed in the aerobic zone of your heart rate, which is 70% of your max heart rate. And your max heart rate is calculated by subtracting your age from 220. So if you're 30 years old, we start with 220, subtract 30, 190 is your max heart rate. You should not be exercising at prolonged periods of time above 190 if you are 30 years old. The aerobic zone starts at 70% of that, so 133. So if when you are walking, your heart rate is between 133 and 190 for 30 minutes, 3 times per week, that is exercise. If when you are walking, your heart rate is still hanging out at 87, 88, 89, that is transportation. And while transportation is good, it is not exercise. So we can find some things to do to exercise. If you like cardio, we encourage cardio. Treadmill, elliptical, running, swimming, absolutely. You have an indoor bike. My Peloton leaderboard name is Off My Meds 8, and some of my mamas and I follow each other. Other things, if you were lifting weights prior to pregnancy, you can continue at whatever weight you were lifting prior to. You don't need to increase resistance during pregnancy as your baby and your body will do that for you. Squats are my favorite. Please, please build up to at least 50 squats per day. If you are already doing more than this, keep going. But squats help to get that pelvis open and long and lean and help that baby's head to descend in the right position. Other exercises that do that as well are Pilates and yoga. And any experienced instructor will be able to tell you what the appropriate modifications are for those two things. Exercises you want to avoid: high intensity interval training after your first trimester. It's not the interval, it's the intensity. So you can do the low impact version of a lot of those. Anything that has you lying flat on your back for excessive amounts of time, like ab work, you can do side lying abs, you can do standing abs. Hot yoga, unless you're a hot yoga instructor, you'll want to, and are fully acclimated to that, you can get dizzy and pass out and fall on your belly. Scuba, because of the barometric pressure, decreasing oxygen to the baby. Same thing for high altitude hiking. 8 to 10,000 feet is usually where we say you're okay. You can visit your family in Colorado, but just don't go hiking with them. Contact sports you want to avoid: anything that has arms, feet, or balls flying at your belly. Please don't do that. And then outdoor biking after 16 weeks isn't a no. It's just to be careful, because around 16 weeks is when your center of gravity changes. You start to get that cute little wobble. That may mean your baby's head is crooked too, but we'll talk about that later. So outdoor biking after 16 weeks, just be careful, because as you turn those corners, you may lose your balance and fall over. Next, we have a poll question. Now that we've talked about diet and exercise, are you able to prevent gestational diabetes with diet and exercise? And the polls will be closing in 5, 4, 3, 2, 1. Done. You cannot prevent gestational diabetes with diet and exercise. You can manage it with diet and exercise, but you can't keep yourself from getting it. So remember when I said we were going to talk about gestational diabetes? This is it. Now we're having the talk. So the reason we screen everyone for gestational diabetes is because of your hormones. Gestational diabetes is due to hormones given off by your placenta. The placenta has hormones that tell your insulin not to do its job. And the job of insulin is to carry the glucose into your cells for use for energy. When your insulin's not doing its job, you have extra glucose circulating in your bloodstream, which is diabetes. Because it's diabetes due to your placental hormones, it is gestational diabetes. So if you can do this pregnancy without a placenta, then I don't need to screen you for gestational diabetes. But everyone, regardless of their size, their family history, anything else, is at risk as long as they have a placenta. So I know I have some moms who say, "Well, I never eat any sugars at all." You eat some like fruits and whole grains, so don't avoid your good carbohydrates prior to the test. If it's the actual drink that you're trying to avoid, that's fine. We have lots of options for you back on that box that we didn't click on the website. There's fresh tests, glucorganics, and things like that. But here at the office, we have Simply Pure, which is soy-free, it is dye-free, it is gluten-free, VVO-free, kosher, and vegan. Offensive to almost no one. And so those other options that I mentioned, there are links to them on the Full Circle website. If you plan on using one of the alternatives, please let your provider know so that she can write it on your lab slip. Also, Quest does not take outside drinks, so we will have to send you to LabCorp or a different commercial lab. So just know that all that information is out there for when you're about 24 weeks. All right, informational classes for preparing for birth, childbirth education. These represent hypnobirthing, hypnobabies, Lamaze, Bradley method. And again, if you look up any of those methods, these are some of the things that you'll see out there. And so these are just for informational purposes. There may be multiple people who offer these things as well. Next, you'll see breastfeeding classes, La Leche League. The midwives can give you information on that. And there are also breastfeeding classes that are being held at Full Circle. So please watch our socials. We'll share those links as they post them too. Every new parent should know CPR. So this link is out here for Red Cross to take a CPR class. If you're already seeing a chiropractor, way to go. Make sure he or she is Webster certified. It's a special pregnancy certification for all the changes that your body makes so that they make adjustments that are still safe for you and your growing baby. My next question is, who is planning to work with a doula? So we're going to talk about what doulas are in case someone is not sure. And the polls are closing in 5, 4, 3, 2, 1. Great. There are some people who are not sure, but there are a couple people who already know that they plan to. I hope, VBAC Mama, that you're the one or one of the ones who's out there planning to, but first time moms too. So what is a doula? Doulas are there for emotional and physical support. So I know you think, but I have a doctor, I have a midwife, I have a nurse. I need a doula? Yes. So before, during, and after pregnancy, your doula is there to help you process information about your pregnancy, discuss your plans, help you advocate for what you're like, help you find your words. For conversations with your providers. During labor, they help with breathing techniques, positional changes, and relaxation strategies during labor. They are part of the medical team in that birth is physiologic and emotional and physical. They are not prescribing medications for you. They're not recommending courses of treatment for you, though, because they are not medical. Pregnancy is both. It's physical, emotional, and it's medical too. So we are your medical team. They are your emotional support. Remember, your midwife may have multiple people in labor at the same time. And those babies might meet in kindergarten years later. But your doula will only have one client at a time. And so she is there with you the entire time. And your doula should not deliver your baby either. That's literally our job. So again, they're not giving your medical advice. They are helping you process your feelings about the medical advice that is given by your medical care team, us. Ask the midwives for recommendations for who their favorite doulas are. What you want is someone who really matches with your personality and aligns with your beliefs. You don't want somebody who's going to be annoying to you when like in between contractions. And the best doulas who we worked with, like they come to your house when labor starts. They come to the hospital with you. They are at your side, and they do not leave until your baby is latched. So those are the ones that you want. Like if they start talking about doing, phone call doulaing from, wherever that they are, that's not emotional and physical support that you need to be present. Acupuncture and acupressure are fine. Pregnancy massage is okay as well. Some places will require a letter. So if you need one, let us know. We have a pre-printed okay for pregnancy massage. A lot of places just won't do it in first trimester, letter or not, because first trimester by itself has increased risk of miscarriage, and they don't want you to associate those two things that are probably unrelated. Next, breast pumps. Most of your insurance companies will cover breast pumps. They require a prescription from us. We have a company that will contact your insurance company, find out which pumps they will supply to you, send you a list of them, write the prescription, and send it to us. So all you have to do is check, 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 and all we have to do is sign and send. Please don't go find your own company to get breast pumps because they end up sending us reams of paper asking for all of your records and all of these things that don't matter. We found a very streamlined process, and just let us do this. You'll get your breast pump. If you start the process at 20 weeks, you will have it long before your baby is here. Also, we are using a third party for FMLA paperwork. So if you are taking family medical leave with regard to your pregnancy, not disability, please ask your HR people what the difference is between those two. But FMLA, we're using a third party vendor, and most of the forms are completed in less than 24 hours. So when it's time for FMLA for you or your spouse or whoever is going to be caring for you during this time, please let Tony know and she'll direct you, she'll point you in the right direction for that. All right, postpartum care, because one day you won't be pregnant. For my mamas who have issues with blood pressure, we see you about a week, like within 3 to 7 days after discharge from the hospital. Incision check for my moms who had belly births, routine mental health screens for everybody over 2 weeks, with or without history of anxiety or depression. Postpartum doulas are a thing. So when else do you need more emotional or physical support than when you're home and you just had a baby? The motherhood space is an amazing resource here in Jacksonville, to which we refer heavily for moms who are at high risk for postpartum anxiety and depression. It's a program in conjunction with Baptist Hospital and the Y downtown, the Winston. They have yoga and counselors and childcare for any baby 6 weeks old to 12 years old, right there at the Y. And it's just an amazing grant that was given to this city and only 5 other cities in the country. Pelvic floor therapy is a standard in many European nations. It is a standard here too, because birth changes things. Pregnancy changes things. So no matter how you deliver belly birth or vaginal birth, things move around. And pelvic floor therapy is a good way if you're having urinary incontinence, if you're having pain if you're having pain with intercourse, or vaginal or vulvar pain after delivery, helps to alleviate a lot of those. And so we have a nurse who comes to our office 3 times a week. She's in network with anybody we are in network with, and we'll get you taken care of here and put things back where we found them. All right. Lastly, frequently asked questions. You can sleep on your left side. You can sleep on your right side. You can sleep on your back. If it makes you dizzy to sleep on your back, you can get a wedge pillow off of Amazon and just shove it under one hip. That way you can't roll all the way over onto your back. But not being on your back is actually more for when you're in labor. So you can help paint the nursery as long as you're in a well-ventilated place or wearing a mask. You can take probiotics. You can dye your hair, including your eyebrows. You can do gel nails. Just if you're going to be in the salon, Utah, I don't get my nails done, in the salon with a lot of fumes and things, you may want to wear a mask so you don't get sick. Car travel, so y'all will be pregnant around the holidays. Travel in the car is fine up to 37 weeks. After that, it's not that it's dangerous, it's just you might have your baby because you're full term. You don't want to do that with strangers. You want to do it here with us. Just be sure you're getting out of the car and stretching every 2 hours. For air travel, for my twin moms, you can fly up to 32 weeks. My singleton moms up to 36 weeks. Be sure you're wearing compression hoses and doing your toe raises and drinking lots of water, so you're having to get up and go to the bathroom frequently to avoid blood clots in your legs that can go to your lungs. For skincare, you can use salicylic acid, your benzoyl peroxide, just nothing that has retinol in it. A retinol alternative is bakuchiol, Bakuchiol, and that is something that you can find in a lot of natural-based products that substitutes for retinol but doesn't have the harmful effects for the baby. Things you want to stay away from as we're ending the summer, roller coasters and water slides. So don't go chasing waterfalls. All right, we're going to do a quick COVID update and we're done. Thank you for hanging in there. ACOG moved from supporting either way to strongly recommending vaccinations by Moderna and Pfizer. We don't recommend Johnson & Johnson because it has an independent risk of blood clots, and so does pregnancy. Boosters are also approved for all vaccines. So if you are more than 6 months past your Moderna or Pfizer, you can have another one. If you're more than 2 months past your Johnson & Johnson, you can have a booster, but not Johnson & Johnson because you're pregnant. Do a Moderna or a Pfizer because mixing and matching is okay. We typically, as you saw on the sheet for what to expect during pregnancy, do those in early third trimester because it gives you time to build up antibodies that you will pass through to baby during breastfeeding. And so you don't have to time this against that because all of these vaccines work differently. So you can do flu, RSV, Tdap, and or COVID at whatever stage or stagger is comfortable for you. If you do get COVID during pregnancy, please do not come to the office. Please do not come to the office. Please do not come to the office. There are no formal recommendations for ivermectin, azithromycin, or Plaquenil, so we do not prescribe those. The things that we do recommend are vitamin D, vitamin C, and zinc in the doses that you see here. If you're under 36 weeks, we recommend a low-dose aspirin because we've seen risk of conversion to high blood pressure in pregnancy with COVID during pregnancy, and aspirin helps to reduce that risk. If you're more than 36 weeks, it doesn't help, and it may increase your risk of bleeding at the time of delivery. And then because of the risk of high blood pressure to the serial growth ultrasounds from the time we diagnose COVID after your anatomy ultrasound. We are, for those who had a baby during COVID before, like the whole epidemic of it, take a deep breath. It's not like that anymore. We're back to having 4 visitors. We're not having everybody wear masks in labor, unless you actively have COVID when you are laboring, and then we don't want you to infect the whole floor. If you do have COVID during labor, we still do not separate you from your baby. We bring an isolate into the room to protect the baby from the respiratory droplets. And we do still encourage breastfeeding with an N95 mask. So the last question I have is, what information can you find on the website? Can you find the birth plan template, safe medications in pregnancy, what to expect at each visit, or are you an A+ test taker and you know that it's all of these things? And awesome, the polls are closed. I think this is a record. I don't think I have one single question the entire time. I'm hoping y'all are just listening to this as a podcast and hoping that you're going to play it back later on. But please remember, we are social, so please feel free to follow us on all the things. We're on Facebook, Instagram, X, formerly known as Twitter, and YouTube, which is where this video will be for the next 6 months or so. Okay, still not a question, but it's a thank you. You are welcome. You are listening. Thank you. All right. I know you guys pass by 15 OBGYN offices every day to get here to us, and please don't think that we take that for granted. We really appreciate you being part of the Full Circle family and wish you all the best for healthy and safe deliveries. We will see you soon. Bye.